Sleep and Your Heart: 7 Scientific Secrets for Better Sleep and a Healthy Heart. Welcome to the U.S. Health Guide, where we explore scientific secrets to living a healthier life every day. Today, we're diving deep into a topic that many often overlook, yet it has an incredibly significant impact on your heart health: sleep. Have you ever wondered if there's a factor as crucial as diet and exercise but less talked about when it comes to a healthy heart? The answer is sleep. When you drift off to sleep, your heart isn't just resting. It's undergoing a vital process of recovery and protection. Sleep plays an essential role in overall health, especially cardiovascular health. This isn't just a period when your body shuts down. It's a complex biological recovery process necessary for every system in your body, particularly the cardiovascular system. In this content, we'll explore the science behind the connection between sleep and your heart, the potential dangers of sleep deprivation, ideal sleep duration and positions, along with 7 practical, easy-to-apply tips to improve your sleep quality and protect your heart. Let's get started. The science behind it: how sleep cares for your heart. When we fall asleep, our bodies don't turn off. Instead, they perform a series of crucial repair and recovery processes. During this time, the cardiovascular system has the opportunity to regulate blood pressure, heart rate, and other vital functions, helping to regenerate energy and maintain optimal operation. More specifically, during deep sleep, blood pressure and heart rate naturally decrease significantly. This reduction gives the heart and blood vessels a break, lessening the workload they perform throughout the day. This is an essential biological mechanism, allowing the cardiovascular system to relax and recover, preparing for the next day's activities. Furthermore, quality sleep plays a vital role in regulating stress hormones like cortisol and controlling inflammatory markers in the body. Lack of sleep can lead to an increase in cortisol levels, a stress hormone, and elevate inflammatory indicators. Conversely, adequate and quality sleep helps regulate these hormones, reducing the burden on the cardiovascular system and limiting the development of chronic inflammation. The relationship between sleep, hormones, and heart health is a complex and multifaceted network. Sleep deprivation increases cortisol levels, leading to fat accumulation, elevated blood pressure, and an increased risk of cardiovascular diseases. Simultaneously, lack of sleep also raises inflammatory markers in the body, contributing to heart disease. Sleep disruption not only causes fatigue, but actively disrupts hormonal balance and promotes systemic inflammation, creating favorable conditions for the development of chronic conditions like atherosclerosis, plaque buildup in arteries, and hypertension. This highlights the preventive power of quality sleep as it addresses the root causes of cardiovascular stress rather than just treating symptoms. The dark side of sleep deprivation: dangers lurking for your heart. Now, let's look at the darker side of the issue. What happens when we don't get enough sleep? Chronic sleep deprivation, or poor sleep quality, is considered a reliable predictor of high blood pressure in both adults and children. Elevated blood pressure at night due to lack of sleep is strongly linked to increased daytime blood pressure, which significantly raises the risk of stroke and heart attack. Studies indicate that people who sleep less than 6 hours are at a higher risk of developing hypertension. Sleep deprivation also causes chronic inflammation in the body, contributing to plaque formation and hardening of the arteries, a condition known as atherosclerosis. This reduces the heart's ability to receive enough blood and oxygen needed to function effectively. Metabolically, lack of sleep can disrupt hormones that regulate hunger and satiety, specifically leptin and ghrelin. This imbalance leads to a tendency to overeat, crave unhealthy foods, and gain weight, leading to obesity, a major risk factor for heart disease. Moreover, sleep deprivation also increases insulin resistance, leading to a higher risk of developing type 2 diabetes. Numerous studies have shown a strong link between sleep problems and heart failure. People who sleep less than 7 hours per night have a higher risk of heart failure. Sleep deprivation also increases the risk of heart attack, myocardial infarction, and stroke. Specifically, those who sleep less than 6 hours per night have a 20% higher risk of heart attack. And those who sleep less than 5 hours per night have a 3 times higher risk of stroke compared to those who sleep 7 hours. One of the most serious sleep disorders is sleep apnea. In this condition, a person's airway is repeatedly blocked during sleep, leading to oxygen deprivation and abnormal fluctuations in blood pressure and heart rate. Sleep apnea is strongly linked to high blood pressure, irregular heart rhythms like atrial fibrillation, and heart failure. Snoring is often considered merely an annoyance. However, snoring can be a sign of sleep apnea, a serious underlying medical condition with significant impacts on cardiovascular health. When breathing repeatedly stops, the body is deprived of oxygen and experiences increased pressure on the heart, leading to abnormal heart rhythms and high blood pressure. This increases the risk of cardiovascular problems such as arrhythmias, heart failure, and chronic hypertension. Therefore, instead of viewing snoring as normal, it's crucial to recognize that it can be a red flag for life-threatening cardiovascular risk factors. If you or a loved one snores loudly or feels tired even after a full night's sleep, don't ignore it. Consult a doctor to seek timely diagnosis and treatment before serious cardiovascular damage occurs. The ideal dose of sleep, optimal duration and position. So how much sleep do we need to protect our hearts? Sleep experts recommend that adults aim for 7 to 9 hours of sleep per night. This duration is considered ideal for the body and heart to have enough time to recover and regenerate optimally. It's important to realize that not only too little sleep, under 6 to 7 hours, but also too much sleep, more than 9 hours per night, can be detrimental to cardiovascular health. Studies have shown that both extremes can increase the risk of coronary heart disease, stroke, obesity, and type 2 diabetes. This indicates that there's an optimal sleep window, and exceeding or falling short of this threshold can lead to negative consequences. The concept of just enough sleep is a crucial point, challenging the common belief that more sleep is always better. Evidence suggests an optimal sleep duration exists, and both too little and too much sleep are unbeneficial. This emphasizes the importance of balanced and consistent sleep, not just quantity, as a key factor for cardiovascular health. Regarding sleep position, lying on your left side is often recommended as the ideal sleep position for cardiovascular health. When lying in this position, gravity helps reduce pressure on the heart, allowing blood to flow more easily, especially blood returning to the heart from large veins. This helps the heart avoid overworking to pump blood and improves overall blood circulation. For individuals with heart conditions or high blood pressure, this position is particularly beneficial as it helps maintain stable blood pressure and reduces the risk of cardiovascular diseases. Conversely, lying on the right side can put pressure on the heart and other internal organs, potentially reducing blood circulation. Lying on your back can also be detrimental, especially for those with sleep apnea, as this position can obstruct the airway and increase blood pressure. While lying on the left side is widely recommended for heart health, the choice of sleep position needs to be individualized. For those with sleep apnea, avoiding sleeping on their back is extremely important to prevent airway obstruction and increased blood pressure. This indicates that there isn't a single best position for everyone. The most crucial factor is achieving quality and uninterrupted sleep. Understanding the reasoning behind the left side recommendation, such as the effect of gravity, reduced pressure on the heart, while also acknowledging the diversity of individual health conditions and the importance of consulting a doctor for specific issues, like sleep apnea or severe hypertension, will provide a more comprehensive and responsible view of health. Secrets to good sleep for a healthy heart. Practical tips. To maintain a healthy heart, establishing healthy sleep habits is essential. Here are 7 golden tips from the U.S. Health Guide for you. Tip 1. Maintain a regular sleep schedule. Go to bed and wake up at the same time every day, even on weekends. This helps your body maintain its natural circadian rhythm, reduces stress, and stabilizes blood pressure, improving overall sleep quality and reducing the risk of cardiovascular disease. Tip 2. Create an ideal sleep environment. Your bedroom should be kept dark, quiet, clean, and cool, with an ideal temperature of about 20 to 25 degrees Celsius, 68 to 77 Fahrenheit. Using blackout curtains, eye masks, earplugs, or a white noise machine can help eliminate distractions. Additionally, choosing a comfortable bed and pillows that provide proper support for your body also plays a crucial role in ensuring deep and restorative sleep. Tip 3. Healthy eating and lifestyle. Avoid going to bed too hungry or too full. In particular, avoid large, heavy, sugary, or spicy meals right before bed, as they can cause indigestion, heartburn, and affect sleep quality. Instead, consider tryptophan-rich foods like bananas, almonds, and warm milk to aid sleep. You should also avoid stimulants like caffeine, found in coffee, tea, chocolate, nicotine, and alcohol at least 4 to 6 hours before bedtime to protect your heart health. Tip 4. Exercise properly and limit long daytime naps. Regular exercise not only helps maintain body weight but also improves heart function and sleep quality. However, avoid intense exercise right before bed as it can overstimulate the body and disrupt sleep. While a short nap, 15 to 30 minutes, can be beneficial, taking excessively long naps or napping late in the day can negatively affect your ability to fall into deep sleep at night. Tip 5. Manage stress and anxiety. Stress and anxiety are common causes of difficulty sleeping and reduced sleep quality. Practicing relaxation techniques such as yoga, meditation, deep breathing, for example, the 4-7-8 method, taking a warm bath, reading a book, or listening to calming music before bed can help soothe your mind and body, creating favorable conditions for deep sleep. Tip 6. Limit electronic devices before bed. The blue light emitted from phone, tablet, and TV screens can disrupt melatonin production, the sleep hormone, and interfere with the body's natural circadian rhythm. To avoid this effect, limit the use of electronic devices for at least 1 to 2 hours before bedtime. Tip 7. Consider cognitive behavioral therapy for insomnia, CBT-I. For those experiencing chronic insomnia, cognitive behavioral therapy for insomnia, CBT-I, is considered an effective treatment method. CBT-I helps change negative thoughts and behaviors related to sleep, including techniques like stimulus control, using the bed only for sleep and sex, restricting time spent in bed when not sleeping, and relaxation techniques. Including information about CBT-I in health content demonstrates a comprehensive understanding of sleep issues, going beyond common self-help tips. This acknowledges that some sleep problems can be severe and require specialized medical intervention. Providing this information not only enhances the credibility of the content, but also guides viewers to appropriate solutions when simple methods are insufficient, helping them seek necessary medical care. Conclusion and strong call to action. In summary, quality sleep not only helps you feel refreshed, but also serves as a solid foundation for a healthy heart. It plays an essential role in minimizing the risk of dangerous cardiovascular diseases. Start applying the simple tips that the U.S. Health Guide has shared in this content today to improve your sleep and protect your heart. Your cardiovascular health is within your reach. If you found this content helpful, don't hesitate to hit like, leave a comment with your questions, or share your experiences. And share this content with your friends and family to build a healthier community together. And to not miss out on fascinating scientific health knowledge that the U.S. Health Guide will bring in future content, subscribe to the channel now and turn on notifications. Remember, every good night's sleep is a valuable investment in your heart health and a life full of energy. Wishing you always have quality sleep. See you in the next content from the U.S. Health Guide.